Good afternoon. My name is Abida Khan from the Department of Virology, National Health Laboratory Service and the University of KwaZulu-Natal. I'm going to present on the KwaZulu-Natal Pediatric Third Line Antiretroviral Therapy Committee post-implementation experiences and HIV drug resistance patterns. South Africa has the largest antiretroviral therapy program worldwide, with 6.3 million people living with HIV in South Africa on antiretroviral therapy in 2024. KwaZulu-Natal province has the second largest population size in South Africa, with a high HIV prevalence and a high number of ART experienced people living with HIV. In 2021, decentralization of the National Third Line Antiretroviral Therapy Committee occurred. It was then that in KwaZulu-Natal province, the Pediatric Infectious Diseases Department initiated a collaboration with the National Health Laboratory Service, Department of Virology. The aim was to facilitate prompt action on routine HIV drug resistance genotyping results and initiation of third-line ART. The study population comprised children and adolescents 18 years of age and below during the period October 2021 until December 2023 who had virological failure on a protease inhibitor or integrase inhibitor-based antiretroviral therapy regimen and who had HIV drug resistance genotyping at the NHLS Department of Virology at Inkosi Albert Luthuli Central Hospital in KZN. A working group was created for NHLS to provide HIV drug resistance results timeously to pediatric infectious diseases. After that, the attending clinicians were contacted for clinical input into the cases, and the cases were then discussed at weekly pediatric infectious diseases meetings where third-line antiretroviral therapy recommendations were made. The implementation of this approach was assessed, focusing on improvements made, and the patterns of HIV drug resistance in this patient group was also analyzed. So the results of the study are: the KZN Pediatric Third Line ART Committee was formed in October 2021. The diagram shows the procedure for the committee and the referral pathway for HIV drug resistance testing in children and adolescents in KZN. So when there's an HIV drug resistance test request in children or adolescents, these cases are discussed by the clinician with Pediatric Infectious Diseases Department or with NHLS Virology. HIV drug resistance testing is done in the virology lab, and once the results are available, they are sent timeously by virology lab to pediatric infectious diseases. Cases that require prompt action, such as protease inhibitor or integrase inhibitor resistance, Pediatric Infectious Diseases Department contacts the attending clinician for clinical input into the cases. And then these cases are subsequently discussed and ART recommendations are made at the Pediatric Infectious Diseases meeting. The average turnaround time for HIV drug resistance testing from specimen collection until the result release was found to have an average of 9 days. And we also found with this procedure that there was prompt action on cases with resistance, with action taken on an average between 7 to 12 days. 385 HIV drug resistance genotyping tests were done in children and adolescents between October 2021 until December 2023. The median age was 13 years and 50% were males. The majority of children and adolescents, 82%, were on a protease inhibitor-based ART regimen, primarily ritonavir-boosted lopinavir, while a small number, 7%, were on a dolutegravir-based antiretroviral therapy regimen. This figure demonstrates the proportion of HIV drug resistance mutations found. There were major protease inhibitor resistance mutations detected in 11%, which required action by the committee. And then looking at the NRTIs, 50% had NRTI resistance, of which M184V was most common. And then looking at the NNRTIs, 58% had NNRTI resistance, with K103N being predominant. Then looking at the integrase inhibitors, out of the 28 on a DTG-based antiretroviral therapy, there were 2 patients with integrase inhibitor resistance mutations. In conclusion, the collaborative approach implemented by the KZN Pediatric Third Line ART Committee improved turnaround times for HIV drug resistance test results in children and adolescents. It improved follow-up and third-line ART initiation. It enabled efficient laboratory clinical interface engagement, holistic patient management, and promoted learning of junior staff who attended the meeting. The patterns of HIV drug resistance observed also support the use of dolutegravir or darunavir-based ART in third-line ART regimens. And therefore, strategies to address and support adherence are crucial in children and adolescents to prevent the development of HIV drug resistance. Thank you.